Good morning, everyone. My name is Patricia Quiroz, and I will be performing Leopold's maneuver, Fundic height measurement, and fetal heart rate auscultation. First is we have the assessment, determine the need for Leopold's maneuver, assess the client's overall condition, and determine when the client last voided or was last tested for urine analysis. And then we have to determine the immunization history, or if there is a history of abnormal fetal presentation in the family, and determine the last menstrual period and expected date of delivery. And then we move on to planning. Take adequate time to prepare for this procedure, and this procedure must be performed during the antenatal checkup. So the equipments to be used are stethoscope, measuring tape, top sheet or draw sheet, and antibacterial hand spray. And then implementation. Check the physician's order to verify the procedure. And then before performing the procedure, introduce yourself and verify the client's identity using the agency protocol, and explain to the client what you're going to do, why is it necessary, and how he or she can participate. And then after that, we have to provide the client privacy and ask the client to empty the bladder before the procedure. And we have to perform hand hygiene and observe other appropriate infection control procedures. Place the client in a dorsal recumbent position, and then place a pillow under the client's head for comfort and under the client's right hip. Ask the client to be still and with arms on the side. Drape the client with a draw sheet and expose from below the breast to the symphysis pubis. Inspect the client for the following: scar, diastasis recti, hernia, linea negra, striae gravidarum, contour of the abdomen, state of the umbilicus, and skin condition. Determine the fundal height using the ulnar side of the palm. In 12 weeks, it is at the level of the symphysis pubis. In 16 weeks, it is in the middle of the symphysis pubis and the umbilicus. In 20 weeks, it is 1 to 2 finger breadths below the umbilicus, and then at 24 weeks, it is at the level of the umbilicus. In 32 weeks, it is halfway between the umbilicus and the xiphoid process. In 36 weeks, it is in the level of the xiphoid process. And in 40 weeks, it is 2 to 3 finger breadths below the xiphoid process. Measure the fundal height using a measuring tape and place the zero of the line of the tape in the superior border of the symphysis pubis. Stretch the tape across the abdomen's contour to the top of the fundus along the midline. Leopold's maneuver. Instruct the client to relax the abdominal muscle by bending the knee slightly and do relaxation breathing. Use the flat palmar surface of the finger and not the fingertips during palpation, and keep the fingers of hands together, and use smooth and gentle deep pressure as firm as necessary. Curve the finger around the uterus top and feel for the fetal part lying on the fundus. Use the palm to palpate the shape, size, consistency, and mobility of the fundus fetal part. Move the hands to the side of the abdomen with one hand in place to steady the uterus, and use the other hand to palpate the uterus opposite side with firm circular motion, and then repeat to the other side. Grasp the lower abdomen's portion immediately above the symphysis pubis between the middle finger and the thumb using one of your hands. Face the client's feet. Use both hands to palpate for the fetal head by gently pressing downward with the fingertips about 2 inches above the inguinal ligament. Omit the fourth maneuver if the fetus is in breech position, as this maneuver is only performed in fetus who are in cephalic position. Place the bell side of stethoscope chest piece in the fetus' convex portion closest to the uterine wall. Listen by pressing firmly and very gently. Count for a full minute by holding the stethoscope chest piece while the other hand feels for the client's radial pulse. Evaluation and documentation. Document the procedure, including the test performed and resulted in the client record using forms or checklists supplemented by narrative notes when appropriate. And then notify the healthcare facility responsible regarding the results and inform the client regarding the findings. Perform a detailed follow-up based on findings deviated from the expected or normal result for the client, and teach the client to do a proper follow-up and provide other appropriate instructions.